And move that out of the way. And so is it this? Yes. Okay, try and keep this annoying thing out of the way. I don't know if I will be able to. If I go to full screen, maybe it will. Okay, that's not bad. That's not gonna bother you, that little thing at the top? Okay, all right. Oop, let me get this out of the way. Okay. I know people will probably filter it, so don't be.
That's okay. Hey guys, I'm Dr. Nicole Poston. So I'm a veterinarian in Kingstree, South Carolina. So we're a mixed animal rural practice. So with that comes a lot of exciting things. So we see a variety of animals from cows, horses, pigs, goats to dogs and cats. So we're a unique practice because there's very few in the state anymore that truly does mix animal. I really enjoy being a veterinarian. So I love talking to you guys because I remember being in your shoes. You know, crazy to think about the time, but that was, 10 years ago, 4 years of vet school and 6 years of practice. So 10 years ago, I was applying to vet school and anxiously awaiting to see my, results and where I'd get in and what opportunities I had. Honestly, looking back in undergrad, I knew graduating high school, I needed to find a good college. A good college would enable me to hopefully go to a good veterinary school. So you're at a great place. I love your professors. They're very passionate about you. We actually have a student at our vet clinic now that graduated from Francis Marion who's going to vet school. I don't know if you know this or not, Brooke Locklear. So absolutely. We also have another student, Kayla Tart, who is from Effingham, Florence area. She did her undergraduate at Clemson, but now she is getting her biology major from Francis Marion because during her year of waiting to see about vet school, she wanted to finish her biology degree. She had, I think, a biology minor at Clemson and worked to finish that major. So again, we have excellent schools in the state, but I think you are by far at one of the best. And, again, I think when I was in your shoes, it was making those grades, getting the experience to better equip me on an application to go to vet school. But again, looking back, again, 10 years since being an undergrad, those are really good years to work on yourself, to really enjoy being in school. If you do not love school, do not go to vet school, because I joke that it's 8 years of studying really hard to get to do something hopefully you'll really enjoy when you get done. But I enjoyed school. I enjoyed sciences and math and being hands-on in labs and things like that. And you'll continue that in veterinary school. So if you love your biology courses here and your chemistry and your math and sciences and communication, you will be great in vet school. I will say, going from high school to Francis Marion, as y'all know, is a step up. I remember freshman year, made really good in high school, and then coming to Francis Marion, everybody told you it'd be harder, and definitely those courses were. When you go from undergraduate to veterinary school, it's another step up. Instead of taking, 16, 18, 20 hours, you take a massive semester load, and it's straight sciences. There's no electives to kind of cushion your load. So I would say each step is a step up. But with each step, you get more responsibility, and it prepares you for the responsibility you have as a vet when you get out. Because I think back to the day of an undergraduate, you have those midterms and those finals and those cumulative exams. And I'd be like, why are they making us do this? It's so much information. But when you get out as a vet, every day is a quiz. Every day is a test, essentially, because you're examining a patient. You're piecing things together to try to figure out what's going on with that particular pet. And it may not be straightforward. Instead of multiple choice, you have open-ended answer, basically. Some things will be clear and straightforward when you get into practice, and some things it's not A, B, C, or D. You have to think through a problem and think through a scenario. But again, you are on an excellent career path. And the thing is, even if you are unsure of veterinary school, I would encourage you to go out and get experience. Volunteer at animal shelters, volunteer at organizations that will get you around people and animals and see how you like that. And then two, volunteer at your local vet clinics. We love students at Francis Marion. If you are eager and enthusiastic, that's how a lot of us started, is we would volunteer at the vet clinic and kind of build our way up. So getting any experience will help you for vet school. And again, that's a huge commitment to go to veterinary school. The finances, the time, the dedication to the career. So find out now if it's something you think you can do lifestyle-wise and time-wise and money-wise. because again, it's an excellent career, but it is a very big commitment. So, but this slogan is one of my favorites. It was one that I heard in undergrad: real doctors treat more than one species. And it's kind of a joke on the fact that you have to know so much going to vet school. You had to learn about all the species, even if you want to come out of school and be a small animal vet only, or just work on cats. You have to learn about all the species in vet school. So the anatomy, the physiology, what medicines work, what diseases are out there. You had to learn it all in vet school. It makes it even more complicated in my mind. Just the species difference and just the cumulative part. Again, our national boards, our NAVLE was on all the species. There were some questions on that exam. I was like, I've never heard of this in my life. But most of it you do know and learn in vet school. But there is so much information. There's no way you can learn it all. So again, in undergraduate, where they make you learn to think critically and learn to do research, those things are still important, because when you get out of vet school, you'll know so much information, but you'll every day have to research and grow and continue to be an excellent vet. So again, y'all probably know this if you're sitting in the room, but a veterinarian is someone who is qualified and trained to treat injured or diseased animals. And again, why become a veterinarian? Again, I love the fact that every day is a challenge. I'm going to have a sick patient that we're not sure what's going on with it, that I have to take, piece together a history of what the client thinks versus what we know about the patient versus what we see on the exam or on a lab result or an x-ray that helps me piece together what's best for that patient. Again, every day I know essentially what I want to do at work. I know I'm going to arrive there between 7:30, 8 o'clock, and I'm going to spend most of my day probably doing surgery or in exam rooms. There are the routine surgeries like spays, neuters, mass removals, but also you get foreign body surgeries where they ate something suspicious, but what is it? What is it affecting? How do you treat it? Or a fracture where every fracture is different, even if you know the essential parts of it. So every day is a challenge. You don't know, even though you have a set schedule, at our practice, we don't know if we're going to have an emergency colic at the end of the day or a C-section walk-in at 11:54, when we take lunch at 12. So, every day is a challenge. Every day you have a sort of a structured day, but you also have those emergencies and those cool cases that walk in that you have no idea that you would even see that. Two, I've done annual exams and find something really cool. Like my intern mate in our first year in Texas, we had a dog come in for an annual exam. It was a young, healthy lab. Young, healthy, no complaints from the owner, said, I can't put any weight on him. He won't gain weight. She did her exam. She made me feel it and my boss. And we were like, something feels odd in that stomach. We took an x-ray. That dog had swallowed a tennis ball. And it had been in there for who knows how long. So a basic routine annual exam led us to finding a problem that the owner never would have suspected. That ball had been in there moving around in the stomach, and that's why the dog wasn't gaining weight. It couldn't fully, absorb its food, and the stomach was super inflamed. But it just shows you on how important routine exams and care and paying attention is in veterinary medicine. So again, I think it's one of the most fun jobs, and it will surprise you every day. And again, I love putting this up here because if you want to go into the profession, this is from the American Veterinary Medical Association page, the veterinarian oath. We are vowing to use our skills and our knowledge to help animals and help people. They push the One Health movement in vet school, and it's because you have a huge responsibility. You are an advocate for animals. You're an advocate for people to make the right call, to help, instill, education in the clients. Because sometimes they just don't know what they're supposed to do with their pet. They don't know what's the best food or the best, medicine to treat something, or just, especially large animals, husbandry and diet and environment are huge for these guys. So educating them and instilling that knowledge to the clients and utilizing your skills to help animals is what you're called to do as a vet. So again, you're probably wondering, well, what happens in vet school? Again, we talk about it so much of, I want to go to vet school, and what does that look like? Again, from the time you start applying to vet school to the end, it really is just an amazing process. I mean, just the steps it requires to go to vet school, to put in your application. The VMCAS is extensive. You have to answer questions and write personal statements and record all of this experience. And in the moment, it seems really daunting. But it is neat to see all that come together to an acceptance. Well, I know when I was applying, every time you'd get an email or a notification, you'd be like anxiously awaiting. But in veterinary school, it's a step up from undergraduate. Everything you've learned in undergraduate prepares you. It seems like at the time it, is overwhelming, but it really prepares you to step up and fill those course material. In vet school, I was so excited to start. It truly was drinking out of a water hose. Like the first couple of days, it's kind of like the first few days of class, you kind of go over the syllabus and things like that, and then it takes off. But truly, it was rewarding because every class to me was something I need to know later. There is details that you forget about down the road, but remembering the big main points, remembering how the anatomy and physiology connect to your clinical disease, and progressing from those basic fundamental courses that will not change, knowing anatomy, knowing physiology, knowing immunology, all those things accumulate to the physical exam and disease and treatment. So going through that progression is what really truly is rewarding, and to get into clinicals toward the end of vet school where you see the reward of all you studied and all that hard work pay off to where you can treat clinical cases. So again, to me, the most fun part was interacting with patients, but you have to start off again in those surgery labs, in the classroom. This is the best surgery group you'll ever meet. So the two friends up there, the one in the middle attended Clemson, and she is now a small animal vet in Memphis. And then the guy in the photo, he's a neurosurgeon in Ohio. And then I work here in Kingstree doing mixed animal. So we're all in different settings. But we all, I remember starting out doing surgery, our first surgery was intense. Who you're surrounded by is very important, and these guys cheered me on. I was so nervous to do my first surgery, and now it's my favorite part of my job. I spend all my day in surgery. We recently hired a new vet, and she is 2 weeks out of school. And she was like, I just want to be as fast as you are in surgery. And I was like, give it 6 years, because, that student in the photo, we were excited in that picture because it was our first surgery day. But to see that growth from first day to now is incredible. Again, it's just like school, just that slow build of accumulating your skills and seeing those cases. Now I do a spay and there's no stress. It's smooth most of the time. You still get some of those really hard cases, but again, seeing the growth from vet student to baby vet to being 6 years out, 10 years out, and even like Dr. Coker, who's on that practice for 40 years, it's like breathing to him. Now I still want to get to that point, but you see the growth over time and it's really amazing. But I love that picture because that was the day of our first surgery and you could not wipe the smiles off of our faces. We were so excited.
So was that an actual course?
Yes. So
what you have some lecture, then you have a laboratory component or multiple?
Yes.
How often were you doing surgery? Of course.
So at that time, not super often. It was like once a week back then. So our first year, and the slides will kind of go through it, but the first year you're in the classroom and you're learning the anatomy and the physiology and the histology and immunology. Your second year, you're starting to get into those courses like small animal medicine and surgery. The courses that really kind of make you feel like you're in vet school, that you're actually taking that step. This was part of our small animal medicine and surgery rotation. So it was a laboratory component where we got a shelter dog every week. And they would come to us, we would practice our physical exam because knowing normal is important. So we would check these dogs for, normal findings, abnormal findings, and then do surgery on the dogs. So we would keep them for a week. They'd come in on a Monday, we would do surgery on a Thursday, and they'd go back the following Monday. So it was a rotation. So every week, like 1 week I was surgeon, Keaton was anesthetist, and Ryan was assistant, and then we'd rotate. Someone else would be the surgeon, anesthetist, assistant. And so it allowed you to fulfill each of those roles. When you actually become a vet in practice, most of the time you're all three. You don't always have someone monitoring for you. We have excellent technicians and they really help us out. But at the end of the day, you're responsible for all those components. In school, they kind of ease you into it. 1 week, you're just responsible for this. But it was a team effort. I mean, it was as important for me to watch my patient as an anesthetist, but my focus in school at that time, that week, was one particular role. As you progress through school, they would make you kind of be more independent or kind of look at all the factors more as a whole. But you had to start off doing one thing at a time so you could fully learn that area before adding them all together. So during that semester, you would do surgery once a week for filling those different roles. When you got into your third year rotation, we did surgery a lot more. Like we had a 2-week mobile unit that we just did spays and neuters all day, every day for 2 weeks. And that got you in the routine and the motions of doing those surgeries and being comfortable. In your third year, I also had a 3-week anesthesia rotation where for 3 weeks, we worked with anesthesia techs and anesthesiologists and vet students, monitoring these patients, figuring out which drugs work the best and the easiest, and saw what protocols to use in certain situations. When you get out in practice, different clinics have different protocols they prefer, but you definitely have the flexibility to choose what drugs you like for different surgeries, for different age patients, signal meant. So their age, breed, and underlying conditions are super important when you're picking medication or anesthesia drugs or doing a surgery. So again, you're responsible for all of that once you get out of vet school, but you always have good help, hopefully, wherever you are. So, yes, ma'am. No, you're fine.
What school did you actually attend?
Mississippi State for vet school. So Mississippi State is a school that has 5 contract seats. Especially when I was applying, the main schools that had contract seats were Mississippi State and UGA. So the year I applied, they had 5 seats at Mississippi State. And then they had, I think at the time, like 10 seats or so at Georgia. So it's very competitive. There's basically about 15 seats that year.
So with the contracts they have, I know that they offer like in-state tuition with those. I think Georgia has like 7. So
I think they've added some, which is great for you guys.
is that just for in-state tuition, or is that the only South Carolina residents that accept?
Sure. So to get the contract seat means you basically get in-state tuition. So I paid with loans my portion, and South Carolina wrote basically a check for the other half. And it was a $20,000 a year difference. I mean, it was huge, and it's probably more than that now. Because talking to the students now, those prices have crept up. I mean, out-of-state tuition at Oklahoma, Kayla was telling me, is close to 60 grand. I mean, it's a lot for out-of-state. Now, granted, with in-state, mine was sitting right around like 23 or so my first year. And then toward clinicals, it goes up a little more as you progress through vet school. So again, that contract seat is huge. I mean, I tell people, if you can get a contract seat, all the schools are great. Any of the US schools, Ross, those are some of my favorite schools. I've had friends go all different places. If you can get a contract seat, for the sake of finances, you are way better off. Way better. I mean, it was basically $120,000 difference for me. And unlike undergraduate loans, because I was lucky in undergrad, between scholarships and et cetera, working, things like that, I came out of school basically with no debt. Then you go to vet school, there are scholarships. I mean, getting the contract seat was like basically a huge scholarship essentially, but it still didn't cover, my in-state tuition, my housing, my cost of living. So essentially the scholarships are there. You can get hopefully a contract seat. There's yearly scholarships you can apply for, but I felt like they were drops in the bucket compared to actual cost of living and tuition. However, there are options if you can work hard, try to budget really well in vet school, work hard to kind of keep that cost down the best you can. I mean, some of it's unavoidable. I would say hands down, pick a contract school if you can get a seat. Again, it's competitive. 17 at Georgia, 5 at Mississippi State. That's really not a lot for the state.
NC State offers some too, but I have to contact them about the seats.
And I think too at NC State, if you can get in after your first year, I think they establish residency.
Yes.
Is what I have heard. The problem is NC State they have very few out-of-state seats. I know the year I applied, it was like 25 seats for out-of-state students. And again, I was like, on top of everything, I was like, surely, again, it's 3 hours away from home, but the seats are so limited, it's almost like getting a contract seat because the spots are so limited. And I know our students applying this year, they were holding on to NC State, and I said, that was the one I got waitlisted on. That was the tough part there is they are very competitive because they have way less out-of-state seats in some of the other schools. Class sizes have increased over the years. I mean, it's been a while since I applied, but I remember thinking, what's the odds of me getting a contract seat? What's the odds of me getting an out-of-state seat? And I really weighed my options of, do I want to apply to schools that are out of state because of the increased cost? I think that's a personal decision. In the moment, all I wanted to do, to be honest, was go to vet school. I wanted to get in and go to vet school. I was not super concerned with money at the time because I wanted to go. It was important to go. Hindsight, and people, my parents were like, you wouldn't have done this, but hindsight, I applied to 4 schools. 2 were contract, 2 were not. And I said, if I don't get into those, we'll reapply next year. I've seen people apply to like 10 right out the gate. Honestly, if you're a South Carolina student, I would recommend trying to stick to the contract schools or ones that have potential for residency, again, because of the money difference. In the moment, I would have been upset if I had not gotten in straight out of school. However, I had friends that waited a year or 2 and got in that 2nd or 3rd round with a contract seat, and financially they are a lot better off. So you can easily get your feelings hurt and say, well, someone got in their first year out. Well, where did they get in? It takes time. One of my absolute favorite people, hands down, from Clemson, it took her 3 years to get a contract seat. And her grades were not that far off from mine. She volunteered. She was on show team with me. Like, she did everything right. Just because you do not get in your first year or 2 does not mean you're not an excellent candidate. It does not mean you're a good person. And if you don't get a contract seat, I know Ryan was one of the last people to get accepted in our class. He got called off the wait list. He wound up being president of our class, one of the top in our class, and he's a neurosurgeon. So just because you have to wait a year or 2 does not mean you're an excellent student or that you're not a good person. Like, it is competitive. Like, it is hard to get into veterinary school. Again, I don't know how I got so lucky, so blessed. Contract seat first year. I worked really hard. I focused on my grades. I really put in a lot of effort. But most people, sometimes it takes a year or 2, and that's okay. If you don't get in your first year, it's nothing to stress over. Again, in the moment, this is hindsight, but in the moment, I would have been upset too. But I would say if you truly want to go to vet school, there is nothing wrong with applying to those contract seats the first year or so, seeing what happens, and then you can expand your reach. But also, I've had friends go to Kansas State or Texas A&M or Auburn, and they paid out-of-state tuition, but they love the school. They're excellent veterinarians, and they're making it work. So again, it's up to you on what risk you want to take of how far are you willing to move, how much are you willing to pay for school. But I would say if you can get a contract seat, that's the best thing for hope of financial freedom, because there is a student debt to income, ratio there. But if you work hard, you can make it work. So, but I would be cognizant of it. But again, I chose 4 schools. The first one I found out I got accepted into was Auburn, and they were out of state. And I said, you know what, if I get in and that's my only option, that's it. But I would encourage you financially to think about those contract seats. If you don't get in that first year with contract seats, you can easily expand your view. But I mean, I loved Auburn. I love Texas A&M. I mean, those are good schools, NC State. So there are excellent schools that are out of state. You're just going to pay more for it.
So
Yes, ma'am.
since you had Brooke on there, I think I heard this from her and another student. So I think Brooke had graduated a year ago,
Yes.
and then she was probably working with you,
Mhm.
and then applied and got in. I don't know if she applied the year she was planning to graduate from FEMU, but I do know a student named Cassidy Pony, and she graduated over a year ago. She's working at another clinic in Florence. And another person that works at that clinic said, we've heard now that vet schools won't even consider accepting your application if you don't have the bachelor's degree. Have you heard anything about that?
They really like a bachelor's degree.
So even if you're like applying to a lot of our students be applying, the beginning of the fall, a year ahead when they want to get into vet school, they have a full semester to go to finish their coursework. And
Sure.
so I just don't know the validity of that. I didn't know how to go about finding out that's true. Or if
Sure.
that clinic, that school would admit that to me.
Sure.
But this is what I'm hearing now from students who said, when I was still a student, but I had a semester to go and I sent an application in, no go, no go, no go. And then some of the other students now, their second round of applications, now they're getting, and so this gap here, I guess don't freak out.
Yes, absolutely.
Don't freak
I
out.
would not freak out.
Yeah.
Absolutely. Especially if you apply as a junior, do not freak out. Like, remain calm, it is fine. A lot of people apply as juniors and do not get in. As a senior, I could see that being more of a concern because then you have to fill that year. I will tell you, my friends who have been delayed a year or two, they enjoyed that year. They went somewhere cool and did a cool, externship, or they traveled or did things to build their resume that they truly enjoyed. So I think you can utilize that year and not make it a waste by no means. I mean, I think the vet schools want to see you take an opportunity and taking, that year and making it something. Again, I think it just depends. I think they prefer a bachelor's degree. I really do. That's my gut feel, is they like to see you get through that entire 4 years. However, 2 of my best friends from Clemson got in as juniors. I did not apply as a junior. I was not, in my mind, I wanted to finish undergrad. It was paid for. Why not finish it? Why not enjoy it? Why not stay in South Carolina? Why not enjoy the curriculum that I was currently in? To my particular path, I just did not think it would be wise. However, I think if you are prepared as a junior and you want to do that, I wanted to finish undergrad. I wanted to enjoy my time in undergrad. My friend Kelsey was different. She said, I'm ready to go. I want to go to vet school. That's what I'm ready for. That's what I want to do. She applied as a junior, got into UGA, loved it. Never went back. My friend Jessica applied as a junior just to Mississippi State and Georgia, just those contract seats. She said, if I get in, great. If not, no skin off my back. They already have my application. They know I'm interested. She got waitlisted at Mississippi State and she got into Georgia. Georgia will let you defer. So she deferred a year, finished Clemson, and then went to veterinary school. So you have the opportunity, again, if you were applying as a junior, I would strongly encourage you, from my opinion, just to apply to those contract schools, unless you were really set on a particular school. Because again, the finances, I do not think it would hurt at all to apply as a junior if that's something you want to do. But again, with me, I was like, I'm not going to waste money by putting it off a year. Why not enjoy my undergraduate curriculum? I enjoyed my senior year, wouldn't take it back for anything. But some people are like my friend Kelsey and want to go, and I think that is fine. I would just, again, if you're a South Carolina resident, I would consider your junior year just applying to those contract schools, because odds are those contract schools are going to, I think they do like to see a bachelor's degree in hand. But again, I had 2 friends from Clemson that got in as juniors. So I think it just depends on the school. I think too, it's getting more and more competitive, which is probably what y'all don't want to hear, but class sizes are also getting bigger. So again, those contract seats are still going to be competitive, but the at-large is getting bigger. So just use that in your thought process of where can I get in? What about contract seats, etc. So
Good for me.
yeah, I think they like that bachelor's. I think age adds maturity in their mind, and if you can finish your curriculum, I think all that plays in. And again, when you're applying, I mean, when I was talking to interviewers at Mississippi State, there was some that already had one profession and were applying to vet school or already completed a master's. So I think that's where sometimes it's a lot of factors playing in on your application and your admittance. I think the main thing is being well-rounded. You can have a 4.0, and if you've done nothing else, they don't like that. They like to see a student that's well-rounded, that's engaged in activities, that has some good grades, that was involved in pre-vet club and organizations. So it's really, in my mind, you got to be a whole package. And grades are very important, but you have to have the whole package for sure. So, yeah. Yeah, so fun things happen in vet school. I was more excited for cows and fun things. Oh, sure. So again, advanced clinical services in vet school, research, which I wasn't super into research. That was probably my negative, is I enjoy teaching and I enjoy being engaged in a clinical setting. Research was never my strong suit. when I had to do it, I guess I did well at it, but I do not enjoy that as much as other people. There were some students in my class that were doing a PhD and pursuing a DVN, and I'm like, well, that's just impressive across the board. That training does take a little longer. Sometimes you have to work through the summers, but there's lots of research projects that you can do in undergraduate studies that really boost your application, that schools really like to see research. And two, you can do summer research in school and they actually pay you a stipend to help. And so that can kind of help negotiate, terms of how much you make and things like that during the summer to help with those loans. And then again, research can be huge for veterinarians because if you don't want to go into clinical practice, you can do very well financially doing research once you get out with a DVM. So I would encourage you to look at all aspects of being a vet and what that entails. Again, some of my classmates do research. Like one of my classmates, she does research at a hospital and she makes excellent money. Her hours are set. She's in a clean environment, very different from other aspects. So I would look into your options as far as clinical practice, research, military, all those are good options. So again, your first year, you have your foundation courses like we talked about. Year 2, you have your clinical disease and surgery labs. Year 3, you start getting into the fun portion, the clinical studies, where you are down in the clinic working with board certified surgeons and internal medicine, clinicians. They are teaching you skills to help you in practice, and you're seeing a diverse realm of veterinary medicine. You're in the ivory tower where you do basically any diagnostic, any test you need. Money is less of an option, so you see kind of an ideal world. They also teach you the practical side, because again, practicing in rural South Carolina is very different from practicing in a vet school. In rural South Carolina, we have clients that have an unlimited pocketbook. And then we have some that are on a very strict budget, maybe a monthly stipend or retired and on a very fixed income. So we see it all. I know my first year in Texas, my boss told me you cannot judge what someone's willing to spend on their animal based on how they're dressed or what car they pull up in or how big or small the dog is, or there are all kind of factors that go in what people are willing to do emotionally and financially for their pets. And again, year 4, especially at Mississippi State, we did 2 years of clinicals. I'm a very hands-on person, so Mississippi State was an excellent fit. Being down in the clinics, I took what we learned in the books and put it to use, really learn by seeing, doing, teaching. And that's definitely what Mississippi State did, is they let you walk through those roles as a student to better equip you being hands-on. I know I talked to people at other schools and I got to do way more surgery and way more clinical time than they did. And that's one of the benefits of Mississippi State. I was lucky because I'm very much so a hands-on learner and have to be engaged, and they engage you as a student, and they put you in the clinics early for that reason. You start doing surgery your second year, you're in clinics early. I really think it makes you a competent veterinarian. So again, here's some of the courses you take. Again, the fun ones, to me are the infectious agents and anatomy. And I was not a huge fan of neurology or parasitology, but they all play a part. And so again, these courses set you up for knowing the basic fundamentals, and then you can start applying it your second year. If you can take any of these courses in undergrad, even if it's human related or animal related or in general, any immunology, histology, anatomy, physiology, is excellent to know those prior to going to vet school. And again, second year looks way more fun. If you look at the screen, econ medicine and surgery, anesthesia, medicine, surgery, special species, so like your pocket pets and your reptiles. That was what I was ready for, is getting into the clinical cases, getting into the fun courses, if you will. And then again, year 3, we did a rotation. So you had A, B, and C blocks, and you would rotate between your courses. So 1/4 of the class would be on laboratory services and anesthesia and radiology. The other 1/4 would be on like small animal surgery or anesthesia, community vet service. So you did a rotation of all these classes throughout your year. And again, some of the favorites were the large animal classes, especially if you like mixed animal, small animal surgery, were definitely some of the bigger courses that you look forward to. Most of the courses were, some were 2 weeks, but most were like 4 to 6 weeks. So they really divided the year well, and you got a break. So 1/4 of the class was on break while the other 3 were going. during that break, you could easily come back and work at a vet clinic to earn some money, or take time, for mental health or family issues, or family time in general. So they really try to give you a break, but yet keep you going really hard. Again, this was one of my favorite rotations, hands down. And this was 4th year of vet school. We did a 2-week mobile unit. This is really neat because we would load up at the beginning of the day and drive to a shelter. And sometimes we have overnight trips, so you'd actually spend the night in a hotel. That way you could work all day, go to sleep, and wake up and work all day. Basically, we did spays and neuters all day long. So we were able to just practice those skills over and over and over again. So that was one of the huge things about Mississippi State. And I've heard that other schools are kind of mimicking that. They want to replicate that at their school because, again, 2 weeks of straight surgery gets you super prepared and super competent. And again, I wish I could have done that 2 weeks, like right before practice. But if you have good connections back at home, we have vet students like Shelby McGee, who's from the area. She's starting in June as a vet at our office. She did her 2-week mobile rotation and then came to us in Kingstree, and we let her practice on more shelter animals. So if you have good connections in the area prior to going to vet school, when you get later in your curriculum, we can help you get on your feet. So know your vets, know your local vets in Florence or wherever you're from. That way, when you come back or when you're on a break in school, you can get some of that experience and kind of keep going. So again, we've talked about this a little bit, so I'm not going to rehash it too much. So again, a bachelor's degree is not required. They tell you that, but I feel like most of the time it's strongly encouraged. It's important to finish that degree, especially if you're, planning to apply towards your senior year. You want to make sure everything is lined up to show you're graduated, that you have all your prerequisite courses, and that you're working on a degree. Most majors, they tell you any major from an accredited college is acceptable. I will tell you, I feel like the sciences prepare you better. Also, if you plan to be a business owner or own a practice, manage a practice one day, business courses are very favorable. I wish I had done more business courses in undergrad, accounting or just straight business, finance, things like that. Because if you own a practice one day, it's like having 2 jobs, running the practice and being a vet. Granted, I have not owned or practiced where I was in a manager role yet, but I hope to do that one day. And if I do, those courses would have come in handy. But in vet school, I did Veterinary Business Management Association. So I took business courses in vet school that were specifically geared to being a vet. So even if you catch it in undergrad or not, there's opportunity to learn about business even in vet school. Like, I made it a priority just in case that was something I wanted to do. Too, I think it never hurts to be business minded, to know how practice runs, to know aspects that would build customer, satisfaction or, client, movement through the clinic. Anything that you can gain from little tidbits is important. So again, GPA, I think, is the most important thing. Working on those grades, getting those grades where they need to be, studying hard, taking hard courses and doing well in those courses will really look good on paper. The GRE, I feel like they weigh it heavier than they should sometimes, like the standardized testing, but they do look at that. And I do feel like talking to people in vet school, the GPA and the GRE is important. There are, at the end of the day, there are factors that go into it. And I think, unfortunately, grades are really heavy. If you don't have the grades, I've worked really, really hard to build up other areas to show, hey, I'm well-rounded, I can work hard, I have these qualities. Make sure you have good letters of references that talk about how good of a student you are, how good of a worker you are. They love, I know I worked at a camp and they love that I was a camp counselor. They love if you're a waitress. They love if you are RA on campus, or if you, there's lots of jobs they like, but if you can do a job and make good grades and kind of balance all the things, they really like that. They like to see that you are passionate about whatever you do. So being consistent is good, holding a job for a while or going back to the same job. That's what I've been told based on, especially helping with amendments later, is they like consistency. They like that you can do lots of different things at once or multitask. So again, building your resume in whatever way, you need volunteer hours, you need paid hours, and you need the good grades, good letters of reference at the end of the day, all add up.
I've heard that, some of that schools are now dropping, like Kansas State is dropping the GRE
They dropped the GRE?
as a requirement. And I gotta update my advising, my accredited that school list, but that's true. It was a student who came in for advising,
That's good.
and she told me that, like, really, and so I started looking at the schools, like, they did drop it.
That's great.
Isn't that
I
crazy?
mean, I remember sitting down for my GRE. I had worked so hard through undergraduate to make good grades, to work hard to get the experience. I remember sitting down in Florence at the testing center to take my GRE and thinking, this test really depends and holds so much weight to me getting into med school. Like, it just seems silly that that's what they based it off of, honestly. But again, I mean, the SAT was the same way. So I was nervous about the GRE. You know, I did a study book and I tried, but my score was like average or above average. And I hope that the rest of my experience and my grades kind of really showed off what I could do, because the GRE, I was like, I did decent at standardized testing, but it was not my favorite. So I was panicky over the GRE. But now I think what more students are panicking over, like Kayla was freaking out because of the Casper test. Some schools are requiring a Casper test. I did not have to take the Casper test. I think they implemented that more so with COVID. Like Lincoln Memorial started doing the Casper test, and then other schools have picked it up. But basically, it's a personality test.
Oh, wow.
And I'm very confused because I'm like, how do you know your personality based on a test? Apparently, they give you scenarios. I'm not a Casper test expert, but they give you scenarios and they give you a short window to answer. And I find that fascinating that they can judge your personality based on your responses. I really think an interview is much more effective. But again, I don't get to make those decisions. But the Casper test, like our two students currently, they made like basically the same score on the Casper test. Both are really good students, but they were opposite personalities. Like I have no clue how they made the same score, because they're very different personalities. Both are very good personalities, but they're very different. So I'm just not sure how the Casper test works. But that was an added stress to them, because you have the standardized testing and then you have this Casper test that you're supposed to answer a question in a very short amount of time on a computer. I'm not sure I would have done well with that. I mean, I did much better in my interview when I was sitting in front of people having a conversation. I do worry too, like the COVID has brought about a lot of like FaceTime or like Zoom interviews. And I do not think I would have done as well in those settings, but y'all's generation had to deal with that through college and do a lot of Zoom meetings. So I think y'all would probably be in a much better state than I would be. I never did Zoom until COVID. And I felt like,
I didn't either.
I was like, this is strange, but I did much better in person talking to them than I think I would have on a Casper test. I think you can tell a lot more about a person in person than on a Casper test, but that was a factor I didn't add in, but it truly is a part. So I don't even know how to do better on that. I mean, I think there are tutorials, and I think our students this year did that. But again, I don't know how you change your score on that. I think it's one of those factors. If you're meant to go to vet school, it will fall into place. So again, personal preparation, I would say expose yourself to veterinary medicine. It is different than what most people picture. You know, sometimes it is long hours, sometimes it's, you know, being in the rain or the snow or the muddy environment, especially if you do mixed animal in the South. However, there's a variety of settings. So expose yourself to research settings, expose yourself to shelter medicine, work in a mixed animal practice, work in a small animal only. I think if you see lots of different settings before you go to vet school, and then you couple your experiences in vet school, you can easily find an environment that you fit into. Again, the benefit of working in diverse settings is when you get out, you have unlimited options. I mean, truly, you can go into about any type of practice. I have classmates that do feline only. I have classmates that work at the mobile vans that just do vaccinations. I could not do that. I would be bored out my mind just doing vaccines all day. However, it's a consistent schedule. It's good money. So I think you got to find what fits for you. I have friends that work as neurosurgeons and work on cows, and I think all the different things add up to what makes you happy. You know, what environment do you want to work in? Do you want to be indoors all day? Do you like going on farm calls and getting outside? I truly like a mix. I like being in surgery most of the day and then farm calls in the evening, and then I go home. So, you know, it depends on what works for you. And again, different practices. There's some practices that work 8 to 5. There's some that work 12-hour shifts 3 days a week. And then there's mixed animal that you definitely work more hours, but I think it's more rewarding as a whole. So I think finding where you fit in is super important. But again, before school, they want you aware of the career. That's often what they ask you about in interviews. How aware are you about the career and the lifestyle of a vet? And then cost and time commitment going to school, which we've talked about. And then again, getting to clinics, getting to mobile practices, getting into lab research and figure out ways to build your resume and well-rounded. So again, I would strongly recommend volunteer hours on your application and paid hours. If there's a way you can do that. They like to see you volunteer at animal shelters or volunteer doing a bake sale and things like that. At the same time, they like to see that a vet office hired you, that you work for them. So again, the level of commitment there, they tend to hound on. Again, volunteer at a zoo, shelters, ranches, even owning pets. Like if you own horses, or if your family raised goats, or if you breed, labs, whatever you do, make it unique to you and own that. Again, my family didn't raise animals. I had to work for my horse experience. I would volunteer, I would go and do, even at Clemson, I volunteered at the horse barn and I did dairy show team. But even when I lived in the Florence area, I volunteered at shelters. I was at the vet clinic when I had a break. I was working, riding around on calls. So I think, owning, who you are as a person and making that part of your application. They like to see a real you, and you make that application part of you. Again, we can go on and on. There's so many ways you can show interest outside the classroom and show that you're a diverse person. They always ask about diversity nowadays. They ask about diversity and what makes you you and how you stand out among others. Again, I think at the end of the day, you find what you're passionate about and you own who you are as an individual, and you get that experience to back that. And again, every day it's treating more than one species for me, especially doing mixed animal medicine. I mean, today we didn't have all the species, but we had a cock and horse this morning. We debudded some baby goats. We did surgery on dogs and cats. We had a pig come in the office for a lameness exam. So we literally work on all the species, some days more than others. Yesterday, I worked on donkeys and cows. And so every day is different. And again, doing mixed animal, the variety is what really is fun. It keeps you on your toes. Again, I think the most important job as a vet is that preventative medicine, routine annual care, preventing disease, making sure that you notify them if you see an issue with their pet. This is one of my best friend's dogs. And I love that picture because it was just as I moved back from Texas, and it was the first time I was their actual vet. I'd met Devin here at Francis Marion, and we had attended school together here, and then it looped up from meeting her freshman year here at FMU to working on her dogs in Kingstree. So it all circles back. So it's pretty fun to be able to help your colleagues or your friends with their animals. And then again, preventative care for the horses and the cows, same thing. I love this picture because the horse is so large and big and small. We joke that we treat them all, but we do. And then that's Dr. Coker. He's practiced for 40 years. He makes it look easy at this point, but preventative care for all the animals is important. Preventing West Nile or rabies or influenza or kennel cough. All those things are super important that we take for granted. When I went to Haiti on a mission trip, they have rabies rampant there. We don't worry about it here because we vaccinate. We take for granted a $15 rabies vaccine, but to them, it's like worth gold. So that preventative care, we really do a good job at preventing diseases. People die in other countries from rabies, but here, because of preventative care, we don't see those mosquito-borne diseases as much or rabies as much. So it's truly a good thing to prevent disease and keep animals healthy. That's my favorite part of the job. That was my first year in Texas. And that was my boss, Dr. B, and we were doing an orthopedic surgery. We were preparing a fracture. And again, that was, if you talk about stages, that was baby vet. That was like 6 months into practice. And that was me in my happy spot. I didn't really truly realize how much I love surgery until that moment, that getting my hands fully involved in a fancy orthopedic case in vet school and then out in practice. But if you go to a good clinic, when you get out, they let you do cool things and you learn a lot and get hands-on. And again, I learn more hands-on. So actually having mentors that teach you and let you do things. I saw Dr. Beam fix fractures all the time, and I was like, how do you get there? I want to be that. And slowly over time, you get there. But having good mentors, having good help, getting a lot of experience straight out of school. Dr. Coker tells me all the time that first 3 years out of school was like, you should be like taking off with your learning. I feel like vet school was that way, and then out in practice is that way. So you are constantly learning every day, something new all the time. And there's Dr. Clarkson. She was doing a dental. So we do, again, dental procedures, mask removal, spays, exploratories. And there's the baby vet. That was at Texas too. That was one of my first phone calls. I was all excited and young and happy. And I just love that picture because, again, it was what I truly always wanted to do. I wanted to do mixed animal. I was a homebody back in the day. I did not see leaving the Pee Dee, but when I got toward the end of vet school, I got the opportunity. My food animal professor was like, you're really good at mixed animal. You really need to consider going to Texas and working at the practice I did out of school. And so I took on a well thought out win and went to Texas for a year. And again, I got so much experience by doing something different. But then after my year there, I was truly ready to come back to South Carolina. I love Texas. It was a great experience, but I wanted to come back to this area. There are some days I missed it because it was all the large animal you could ever dream of. Like we do a lot of large animal here, but nothing compared to Texas. But it's a different world out there. But to be able to come back to South Carolina, do mixed animal, and be closer to family and friends was a good thing. But that was a good year. I got a lot of mentorship, which is important when you get out of vet school and while you're applying to vet school. So having good mentors gets you really far. And again, now I work on everything. That's, this year that was actually taken this year at a little farm that we go to quite often. They have donkeys, cows, alpacas, they have it all. But yeah, I love working on all the things. But also, production medicine, we don't do a lot here, but in Texas, we did a lot of production medicine. These large ranches, dairies in Georgia or Iowa, other parts of the world, you can be strictly a dairy vet where you wake up at 5:30 and you work until 3 o'clock and it's all you do is dairy. So again, there's so many aspects of veterinary medicine, whether it's farm calls, production medicine, research. And I can't emphasize more, animals of all size. That was a collie we were treating, the big tall horse. I like taking pictures beside the tall ones, but that was a collie we were treating in Texas. This was a castration in South Carolina. That was one of my first years out in practice too.
I like how you're smiling there.
Yes. So I love castrating horses, which is funny to say, but it's a surgery and it's large animal, so it kind of combines the two things. But I really enjoy snapping some of those pictures because I like working with the horses. Colics are exciting because it's an emergent situation. Castration, you're laying a large animal down to do a surgery on them. So, and this was on a farm call, so this was an hour from the clinic. So you're talking about responsibility, you are fully responsible for that situation. And again, I love teaching students. I love being mentored. So the picture on this side was me teaching a vet student how to do a cystotomy. When I was really kind of learning myself, that was my first year in practice. So I was applying those skills I knew, and I had been shown how to do the surgery. I was taught how to do it. People watched me, and then I was teaching someone else the steps. And then this is me and my current boss, Dr. Buckner, doing a surgery. She's looking in on what I'm doing, giving advice. And again, we're all the Clemson fans with the orange, but at the end of the day, having students to teach, I think is really fun. If you can teach it, you can do it. And then being mentored along the way, mentors like Dr. Buckner, Dr. Coker, my mentors in Texas really helped make me who I am as a vet and as a person. So having people to help you goes a long way. You need to be in a good practice when you come out because of your learning. So I talked about Haiti earlier. This was Haiti. I have never worked on so many pigs in my life. There was pigs out of the zoo. We vaccinated so many goats. and dogs and cats and horses because they don't have preventative care there. They would line up and wait for hours for vaccines. They would love to ask you questions about how to treat their animals. I mean, we had a cow that had an abscess like the size of like 2 basketballs. I mean, it was like that cow had been like that for who knows how long. We castrated several donkeys, several horses. Their horses were tiny there and they were wild. So you got the sedation intra-horse. There was no IV or IM, it was get the medicine in the horse. I mean, it was just a different world there. I got a lot of experience in a week just from going and volunteering. There's all kind of organizations that will take you all over the world or the US and give you experience. We had just vet students on this trip, but the organization we went with, they do take undergraduate students. So I would look into going to some of the Indian reservations, do trips, definitely like some of my friends went with Vita to Brazil and different places. So there's all kind of organizations where you can go and do and get experience. But I truly saw the impact vets can make in Haiti, because at the time we went to Haiti, there was 2 vets, 2. They have what they call vet agents, and that's where the vets train basically lay people, intelligent, driven people that they can teach those skills to go out and do because they don't have enough veterinarians. So while we were in Haiti, we even did a classroom teaching session because overall they just needed knowledge. They needed to be empowered. So you take education for granted. The fact you can sit in a Princess Marian classroom, the fact I could go to veterinary school. People in Haiti, they often don't have that opportunity. They were anxious and eager for information. It was honestly refreshing to see people so driven to learn and to do and to gain skills. I was like, if everybody was like that, we'd be fine. And again, that was in Haiti, you did not have chutes. Like in mixed practice now, when I make a phone call about a farm call, I said, hey, what equipment do you have? Do you have a chute to catch them up for safety? Because again, they're big animals, they could hurt you. So in the US, we asked, do you have a chute? How can we, restrain this animal? In Texas, everybody had like immaculate chutes and immaculate horse stocks and things like that to restrain animals. In rural South Carolina, it can be spotty too. I've tied cows to trees. It's fine. But overall, in Haiti, there was no chutes. There was no fancy equipment. You learned how to really rope and do. And so it was a different world. But I love that picture because, it just showed that even in South Carolina, even in Texas, you always don't have the top equipment, but you can still do good. You can use the tools you have and the knowledge you have to impact people and animals and make everything a lot better. So this is a funny case example. Again, you don't have to go to vet school to see that that's broken. I don't know if I have a mouse, but you see the 2 pieces are not lined up together. And it seems easy, right? You just pair them beside each other. But you have to know your anatomy. You have to know how everything works in order to anesthetize that patient, do pain control for that patient, and use the proper equipment to align those bones and to get them to heal appropriately, to minimize infection, to keep it sterile, to make that repair. And again, it's one of my favorite things is to fix a fracture. And you can see now we took a IM pin, so an intramedullary pin, and used it to hold those 2 pieces together. And with pain management, with the owner locking it down and with good technique, hopefully that bone will heal just fine. So again, I love fixing things. I like surgery because it is sometimes more of a faster reward. Even though this took 6 weeks to fully heal, I saw those bones come together. Sometimes in medicine cases, they take a week or a couple months, like depending on what the disease process is. So medicine's fun because you slowly piece it together. You see patients slowly improve, sometimes quicker than others. But with surgery, I like that I can fix something and see it heal and see it come together.
Does a pin like that stay in, or is that something that's removed? Because sometimes the pins get taken out.
Yeah, we remove it because it can be a nodus of infection. And once that bone has calloused and healed, you really don't need the pin anymore. If it heals appropriately, you can get non-unions or issues where you have to leave hardware in. But for most of the time, the goal is to remove that hardware so you don't have issues. But often with TPLOs, like where you fix like a ACL injury, like in a football player, dogs get something similar called a cranial cruciate injury. And you actually leave hardware in that knee, but you do it very sterilely. The goal is to leave it in there. So it is, it it is hardware that intends to stay there for mostly the life of the dog in case, unless there's an issue. I have seen a few that they've had to go back in there, but that's usually not good when that happens. So, but you have to be very particular. Those IM pins, the nice thing about that is you can easily remove that. You don't have to make another incision. If you had to remove TPLO hardware, it's a whole extensive process of going back in that knee. So this is hands down one of my favorite cases of practice so far. This dog came in for vomiting, and it was a 3-year-old Akita, and it was named Monkey. And Monkey was naughty, and he always chewed up stuff all the time at the house. He had never had a problem until he chewed up a bottle of Gorilla Glue. They were pretty confident he had swallowed all of the Gorilla Glue. Well, when you palpated his stomach, this is where a physical exam is important. When you palpated his stomach, it was rock hard. And you could feel it moving when you palpated it. So we took an x-ray. I wish I had saved the picture of the x-ray, but the x-ray just showed this huge glob of like mineralized material. Like you could tell it was not supposed to be there. It did not look like soft tissue of the stomach. And again, you could feel the glob. When we opened up that dog's abdomen, the stomach was like protruding, and you could take it out as like a whole piece. Like normally it's soft and like pliable. It was just a rock hard mass essentially. And so incising into that stomach was hard because most foreign bodies, it's a sock or fabric or a pacifier or something like that. No, this one you had to pry out of there. Like we had to make a huge incision and like work not to make it more irritated. So it was really cool how we had to like work it out of there. And then we took that picture of me cheesing because I truly enjoyed like just that glob. I mean, we had to make such a big incision, and it encompassed, basically it filled the space of the stomach. And it's a curvature of a stomach. Like you can see that it's the shape of a stomach. It expanded and occupied the entire stomach. And what's amazing to me is that the glue plugged the space, it filled the hole, and none of it moved into the intestines. Like he got lucky because it was so quickly drying, hardening, that it did not proceed more into the bowel. Because a gastrotomy is a lot shorter healing time than an enterotomy, which you had to go into the bowel. So it was super cool how it was in the stomach, it didn't go any further, and we were able to have a successful case because of how it expanded and stopped and did not exit the stomach. If it had exited the stomach, I think it had been a lot different of a ball game. But that was the coolest case I've ever seen, hands down. I also saw a case a couple of weeks ago. This is awful. The dog had gone home on ear medicine for an ear infection. The owner accidentally put Gorilla Glue, I kid you not, in the ears instead of the ear medication. So when I say we've heard it all, like clients kind of laugh some days because we're like, make sure you put this medicine in the ear, and you wonder why you stress like by mouth or in the ears. It's because I've seen anything put in any orifice on the body, because like who puts Gorilla Glue in their dog's ears? But the guy didn't have glasses on. They were an older couple. It was an accident. That poor baby's ears, we had to sedate it and clean those ears out and like lavage and like flush out those ears and like put it on medicine to help with the inflammation on the ears. So again, Gorilla Glue fills a space. It basically filled up that whole canal. We're still not sure 100% of the repercussions. Like we sent that dog to a specialist to be examined after us because I mean, who knows what permanent damage happened that we can't see that a specialist could pick up on. It was awful. They were so upset. But again, Gorilla Glue does weird things if you put it in ears or stomachs. So note for the entire presentation, don't put Gorilla Glue where it's not supposed to be. So it makes for interesting cases in veterinary medicine for sure. So. And then I kind of threw this in the midst of the cases because again, at the end of the day, the client that puts Gorilla Glue in their dog's ears, or the client that their dog ate the pacifier or got hit by a car, you know, that is who you're making a big difference with too. It is about animals. You know, most people go to vet school because they love animals and they like a challenge, but people are heavily involved. You have to be able to communicate with people. You have to care about people because if you're in private practice, they truly are the ones that are bringing their pets to you, you know, and every pet is associated with somebody. If you are a clinical pathologist and you read slides all day, probably not as important. But if you're in private practice like I am, doing a mixture, you will interact with clients, you will explain things to them, you will hear their sob stories. on, how they're so upset this happened, or this was their late husband's dog and it's the last connection they have. Like, you hear all kinds of stories, like people open up in the exam room. So at the end of the day, it may be very fast paced, it may be busy, you may have a million things going on, but you do have the opportunity to impact people. This picture of, that's me in Texas holding that little girl. We were putting her horse down. And that was, she didn't know it, but that was one of my first horse euthanasias I had done in practice. So I was kind of emotional because I promised, when you put down a horse, it like chips away at your soul slowly. Like, I think it takes a part of you. And to me, like, these guys had this horse for close to 40 years. And like, I'm taking on the responsibility of making this process smooth. And my boss, Dr. Beam, the same one doing surgery with me, he went out there with me. But that was me and the little girl. After we put the horse down, she was sobbing. And I love kids. And so she was sobbing. And I told her, I said, you want to walk away for a second? I said, let's go over here. Because her mom was losing it too. So Dr. Beam stayed with the mom. I took the kid and we just went and looked at the other horses. And we were talking, and she was so upset about losing her horse and crying, and it got me. But what she didn't know is I was coping with that for the first time too. She was losing her horse. I was losing my first equine patient. So that picture I love, like my Dr. Beam and snapped that. And it just shows how you really do take care of people as much as animals some days. And then here's another case that I think was fun. This happened a couple weeks ago. So if you look at the picture, I think it's hard to tell on the screen, but this dog came in for losing weight for about a month, vomiting, kind of ADR, which we joke in practice ain't doing right. So just kind of overall not doing well. When we took x-rays a month ago, we didn't really see too much, but as things progressed, when we did our recheck and re-x-ray, this object had moved throughout the bowel. So, stomach and liver and spleen are up in this area, and then you have your intestinal tract through here. And this looks like something odd. So if you zoom in, definitely shouldn't be there. Like, that shaped object should not be there. We knew what it was because it wasn't our first time seeing that object, but our new baby vet, she guessed it appropriately, but she was very excited when we pulled out this. So that's a pacifier. And if you look, you can see the wings and the opening. What was happening is it had turned and fecal material was still passing through. But when it turned the other way and completely blocked, that's when the dog started really having complications. So if I can go back, you can see it now, right? So sometimes they're that straightforward. Socks and
Patient history guide you,
yes, absolutely. Vomiting through anti-nausea medicine.
but they have a young child.
The owner was an older lady, but she babysat her grandchild. They didn't notice a missing pacifier because honestly, in the chaos of life, who probably does? Sometimes people do. I've had people say, I'm missing a pair of underwear, or I'm missing this, or missing a toy. And sure enough, it would be what we find in the dog. But, this was very straightforward on x-ray. Some are not so straightforward. We cut into dogs often that we're not sure what we'll find, or we think something's there. They tell you in school, if you don't do enough exploratories if you don't find a negative explorer, if you don't find anything. But often we really have to have a reason to cut. We see dilation in the bowel, or the dog is vomiting and still not doing well. Again, I've explored things and found masses instead of foreign bodies, or not found anything. Some things can be hard to tell. Nowadays with ultrasound and barium studies, you have less of an issue, but cool cases like that make it fun. So now I'll open it up for any questions. This was the day of my gray coat. So that was the first day of vet school for me. It seems like yesterday, but that was the first day of vet school. So they do a gray coat ceremony at Mississippi State, and basically they introduce you to the profession and welcome you, and you get a cowbell because at Mississippi State at football games they do cowbell. So you can't buy your own cowbell, your first cowbell. They had to give it to you or someone buy it for you. So they gave everybody a cowbell with their name, and that was my gray coat. I was very excited. It was like I finally made it. Even though you get that acceptance letter, that initial day is like, here, this is what I'm doing. So it's just funny to think back then to now and all the changes. But growth is a good thing. And I remember being so excited and just ready to get through school and get out and practice. So, but thank y'all for letting me share, and we are happy to help you in Kingstree if y'all need anything. It's Animal Hospital of Kingstree. You can call and ask for me, Dr. Poston. Again, I remember being in your shoes and needing experience and wanting a chance and being enthusiastic. So if you guys need anything or have questions, y'all can contact me, call me, whatever. So, you're welcome. Good, I'm glad. I tried to incorporate what we had talked about. And again, I remember just wanting to know how to go about all the things. So hopefully it helps y'all and gives you some reassurance. It's a good career path. So I'm excited for you guys, and if we can do anything to help you. All right, yep.
I really appreciate it. Oh, yeah, I'll stop the recording.
Sign out of my email.
Let me just stop the share and stop.